I'm imagining you're scrolling through my channel and you stumble on a video that starts with a bold question. What if medicines could be affordable everywhere, not just where your wallet is thick? Today we are taking a creator's eye view on a viral moment. An Australian man in India praising the prices of everyday meds compared to the US, Australia, and Europe. But I'm not here to echo the clip. I'm here to unpack context, challenge assumptions, and ask what this means for viewers, patients, and the global pharma conversation. Personally, I think this topic touches on price, access, and trust all at once, and there's a lot more underneath the surface than a single Instagram reel can show. I'll start by setting the stage. The original video spotlights two concrete examples: a strip of amoxicillin priced around 123 rupees, about $1.34, and metformin around 44 rupees, about 49 cents. The creator contrasts those prices with what you'd pay in the US, Europe, or Australia, framing India as a place where medicines are excellent and affordable. What makes this really interesting is not just the sticker price, but the underlying system that makes those low prices possible, and who benefits or loses when you compare across countries. From my perspective, price is a signal, but it's not the whole story. Idea 1. Price signals versus value. On the surface, cheaper drugs look like a no-brainer. If a $1 pill does the same job as a $10 pill, that's a no-lose scenario for patients. But the deeper question is, are we comparing apples to apples? Are we looking at identical drug formulations, dosage forms, pack sizes, and brand versus generic status? In my opinion, raw price per unit doesn't always map to real-world value. A paracetamol tablet here might cost less, but if it's a version with different excipients, different bioavailability, or if it's less rigorously regulated, that changes the story. What many people don't realize is that price transparency often hides complexity. Quality assurance, regulatory standards, and supply chain reliability all influence what affordable means in practice. If you take a step back and think about it, the affordability question becomes a question of risk, access, and equity across the healthcare continuum. Idea 2. Jan Aushadhi and government-led price controls. The clip nudges us toward Jan Aushadhi Kendras, the government-backed stores offering generics at a fraction of branded prices. What makes this really compelling is how public policy shapes access. My take: government-enabled price relief can dramatically improve affordability, but it's not magic. It depends on distribution reach, consistent quality, and consumer trust. A detail I find fascinating is how these networks balance supply with demand, ensuring medicines are available in rural and urban pockets alike. Another angle: does relying on public channels crowd out private competition, or does it spur better pricing across the board? This raises a deeper question about how to scale affordable generics without stifling innovation or risking shortages during spikes in demand. Idea 3. Global price differential and medicine access ethics. The broader trend here is a global pricing puzzle. High-income markets subsidize drugs for others, but patients in some countries still pay far more for the same active ingredients. What this really suggests is that medicine isn't just a product. It's a policy instrument, a political tool, and a moral question. If you look at the numbers in isolation, India's generics ecosystem can look like a fairness win. But there's a bigger narrative about intellectual property, tiered pricing, and access. In my opinion, the real takeaway is that affordability is multi-layered. It involves regulation, manufacturing capacity, patent law, and international pricing agreements. People often misunderstand that lower price automatically means lower quality or that high prices are the only barrier to access. The truth is more nuanced. Access depends on distribution, adherence, and trust. Doctors, pharmacists, and patients need reliable options at predictable costs. Idea 4. The consumer psychology of price envy. When a viral clip highlights shockingly low prices, it sparks a mix of relief and skepticism. What makes this interesting is how social media magnifies price differences and invites comparisons that may miss the granular realities of a given country's healthcare system. A lot of viewers might wonder, can I trust these generics? Are there hidden costs? The answer, I think, is nuance. Transparency about drug quality, regulatory oversight, and patient outcomes matters as much as the price tag. From my perspective, the takeaway is not just to chase the cheapest option, but to evaluate overall value, effectiveness, safety, accessibility, and the certainty you get from a trusted supplier. Idea 5. Real-world implications for patients and policymakers. If India's model proves scalable, Western buyers could rethink procurement strategies for public health programs, while patients in higher price markets might press for reforms in pricing and access. What this really highlights is attention. How do we maintain rigorous quality control while expanding affordability at scale? My view is that hybrid models, strong public programs alongside competitive private sectors, tend to offer the best shot at sustainable access. A detail I find fascinating is how supply chains adapt to demand shifts, and how cultural expectations about medicine seasons influence trust in generics. In the big picture, this connects to a trend toward decoupling medicine from Wall Street price signals and reconnecting it with public health value. Deeper insight, escape velocity for affordable healthcare. If we zoom out, the pattern is clear. Affordability is less about a single price and more about an ecosystem. Regulation, procurement, manufacturing capacity, and distribution networks must work in harmony. What this raises is a meta question. How do we design healthcare markets that reward reliability and accessibility without compromising safety or innovation? My hypothesis is that the most resilient systems blend government leadership with private sector competition, leveraging technology to increase transparency and reduce waste. People often miss that the biggest gains come not from a single policy tweak, but from aligning incentives across stakeholders: patients, doctors, pharmacists, insurers, and regulators. Closing thought, a spark for a bigger conversation. This viral moment isn't just about India being cheaper. It's about rethinking how medicine reaches people everywhere. If affordability can be improved without sacrificing quality, why wouldn't we pursue that model more aggressively? A crucial question for you, the audience. What do you think is the strongest lever to improve medicine access in your country? Policy, industry competition, or digital supply chain transparency? Share your thoughts in the comments, and tell me which part of this topic surprised you the most. Personally, I believe we are at a turning point where cost, trust, and care can finally align in a way that benefits everyone, not just the few who can afford it. Thanks for watching. If you enjoyed this analysis, hit the like button, subscribe for more creator-led deep dives, and ring the bell so you don't miss the next breakdown. See you in the next video.